Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and LeNae.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
So, hey, Tripp.
Hey, LeNae.
What's the best thing that happened to you today?
You, dear.
Oh, my God. That was too easy for you. I'm trying to find a joke. Here's kind of a weird one. Well, not a weird one. A lame one.
Isn't that a dad joke by definition?
It is a dad joke by definition. What did one slice of bread say to the other before their race?
Before their race?
Yeah, two pieces of toast were about to race. What did one say to the other? Kind of smack talk does toast give each other when toast runs in a race? You don't know.
No idea.
You're toast.
Okay.
Yeah.
Dad jokes.
300. 297 to go. Okay. So in my DMs, I get a lot of people wanting information about regenerative medicine. And then they say things like, when I'm like, well, what kind of pain are you dealing with? They're like, I'm bone on bone. And that sounds terrible.
You can almost hear the grindings.
Yeah, it's a terrible. So people talk and I visualize in my mind's eye what the words other people say. And sometimes I'm like, how do I unsee that? So bone on bone, what does it mean? Are those people candidates? Like, let's talk about that. And do they even really know what that means? Do other doctors know what that means? Tell me all about bone on bone.
So I guess I would be better placed if I were a radiologist to talk about bone on bone, because bone on bone is a term related to the appearance on an X-ray examination, a plain X-ray examination of what degenerative arthritis amounts to, or what long-term arthritis kind of evolves into on an X-ray examination. And there are different stages on an X-ray that show progressive deterioration of the joint. And so what you see is bone on bone is kind of the end product of that erosion and destruction of the joint.
The erosion of like cartilage?
Well, I
like
mean,
they have no cartilage?
So on X-rays, when you have the picture is taken, there's the bone, then there's generally a layer of cartilage, depending on what kind of joint it actually is, and then there's a little space, and then then again the other side generally has some cartilage, which is translucent on the X-ray also, and then there's and you can see a little bit. And then there's, again, bone.
Are joint pain and stiffness slowing you down? At Infinite Health Integrative Medicine Center, we specialize in regenerative medicine therapies designed to actually repair and restore without surgery, without months of downtime, and without a lifetime of pain medications. Our patients are getting back to the activities they love: walking, running, even playing pickleball, pain-free. Ready to discover what's possible for you? Schedule your free discovery call today at yourinfinitehealth.com. That's yourinfinitehealth.com. At Infinite Health, we are redefining what aging means.
Okay, so you've got those kind of 4 or 5 levels of the X-ray that as the joint erodes, and succumbs to gravity, the effects of gravity, let's say, first you have a narrowing of the space in between the two more dense layers on the X-ray, and then it gets thinner and thinner and thinner, and then the two bone levels approximate each other, and then when there's no space in between, then the appearance. And there are other changes on the X-ray that occur at the same time. There's condensation of the bone. The bone becomes denser on each side as the bone reacts to the pressure and the erosion. And then basically you have two dense bony surfaces, or what looks like two dense bony surfaces there. But and in reality, what's happening in there is that it's not, well, bone on bone gives the illusion, as you were talking about, you start thinking about, oh, it's grinding and there's just nothing there to,
Sounds gross.
yeah, to lubricate or to, but in fact, there are still all of the elements for the body to produce, and to repair themselves and reproduce cartilage. So there's still islands of cartilage there that on the entire surface of that bone on bone, there's still islands of cartilage that can be stimulated to repair if there's given the right environment and the right stimuli. And the reduction of generally speaking, there's generally a very high level of inflammation that's there that impedes the repair process, and the stem cells that actually do the repair, they're actually inhibited by the level of inflammation that's in there. So the joint doesn't actually repair itself. The cartilage doesn't repair itself because that environment is adversarial to the stem cells going back to work.
So in an ideal scenario, you would first look to reduce inflammation.
Correct.
And how do you go about doing that?
Oh, well, in the scenario that I see very often here is I'll see patients that have bone on bone or very narrow joints, and they're generally inflamed and painful. And the key to getting an optimum outcome, as I'm thinking, doing the regenerative medicine and using those biological nanoparticles to
mesenchymal signaling cells.
Mesenchymal signaling cells, but exosomes, mesenchymal signaling cells, Morton's jelly, PRP, all of these things actually go in and reduce the inflammation, help reduce that inflammation. But in fact, it's the whole body picture at that point is generally in patients that have that level of damage, generally have very high levels of systemic inflammation too, and optimizing that environment that exists in their body wide actually results in significant amounts of pain resolution, and that's a more complex process. And what we do is I evaluate that with thorough evaluations, laboratory and we optimize that environment in there first before proceeding with the regional or local administration of products to activate the repair process and the patient's stem cells to repair itself.
Do you think that is something that sets you apart from any other person trying to do stem cells?
The combined program that we use is probably superior than to just getting
It is superior. There's no probably. It's superior. But go ahead.
Yeah, it is. I mean, because I will routinely have anywhere from 40 to 60% reduction of pain simply by doing the optimization process itself.
Wow.
Yeah.
That's pretty impressive.
I've had people say, well, I'm going to put off my stem cell process because I feel so good because of the optimization process.
Yeah.
Which it doesn't serve really. It serves, but It may slow the process, the degenerative process some, but it doesn't resolve it. And the results of a local approach are far, far superior than just doing the optimization process.
Do you find that people are open? Because in my head, a lot of people just want a quick fix, and they think a quick injection of stem cells into their joints is going to be the quick fix, and then they continue on their merry way, engaging in the behavior that might have contributed to the pain point to begin with.
So in that setting, it's like the difference between doing a full optimization process and getting, for example, a testosterone shot. You'll get the effect, but it won't have an optimum effect because there are many other elements that are involved in testosterone having its best effect.
Okay. But I guess my question was, are people open to because the optimization process requires a lot of times significant behavioral modification in lifestyle choices. So do you find that people are open to starting that slow and steady shift, to get optimized before they do the regenerative medicine approach, or do you get resistance in that?
Only rarely, actually, do I get resistance to that, because people tend to, after having an explanation, people understand that if they're going to get a better result, especially since it's, the vast majority of the regenerative care is not covered by insurance, most people, understanding they're paying out of pocket 100% for that regenerative procedure, are going to say, yeah, I want to get the best outcome I can get. And realistically, optimization very often creates an environment that makes the patients feel so much better that and it happens fairly rapidly, that taking an extra few weeks to get that done is not cumbersome for them, and they do it. However, there are people, I just want to get the shot and do that, and that brings up the topic of why conventional medicine, reactive medicine, with its steroid injections that actually compromise the joint ultimately and cause rapid deterioration and accelerate the appearance of degenerative joints. It's a quick fix. So you get you get quick pain relief, and it's not a mindful process, because it's going to accelerate the degeneration of a joint, and it's not going to resolve or help repair the joint at all.
Yeah. I think more people need to know about that. That's another episode. I have to put that on my list.
Mm-hmm.
Steroid stuff. Cool. Well, Gal, I hope you found that educational, informational, somewhat entertaining, and until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm LeNae. Until next time, feel it, look it, and live it.